Welcome. I'm Lee Doherty Biddison.
And I'm Carolyn Kumsty Fowler, and we're your co-hosts for the Johns Hopkins Office of Wellbeing's podcast, Vital Conversations, Influencing Workplace Wellbeing in Healthcare.
We spend a lot of time thinking about how to influence workplace well-being in healthcare, and we're excited to share what we're learning.
Thank you for joining us. Hello and welcome back. I'm Carolyn Kumsty Fowler, your host for today, and I'm delighted that you're joining us to listen to a conversation about how we live and work mindfully. Our guest today is Jennifer Salaveri, and she's a licensed clinical social worker who worked in healthcare for 15 years and specialized in working with people who have lived through trauma. But Jen is also a certified mindfulness and meditation teacher, a yoga teacher, and a certified life coach. And at Johns Hopkins Medicine, Jennifer works as part of our Office of Wellbeing team and the Healthy at Hopkins program to support the workforce in lowering their stress. And I hope that you will learn as much from Jen in this podcast as we have having her part of our team. Jen, welcome.
Good morning. Thank you. I'm really glad to be here.
Jen, before we explore the various ways in which we can live and work mindfully, can you start by telling us a little bit about your own personal journey?
Sure. As you said, I have been a clinician for over 15 years now. I like to joke that I started when I was 3, and I really loved working with my clients and my patients. And throughout my life, and certainly in my professional career, I've been really interested in the mind-body connection. So that led me to pursuing training in mindfulness, meditation, and yoga. And I would use those practices with my patients. And it wasn't long into my career that I realized that in order to preserve my own health and well-being, not only as a practitioner, but another human going through this life, that I also needed to use the practices that I was teaching. And perhaps not surprisingly, it really, really helped. So during the COVID pandemic, I really felt called to support my colleagues in healthcare because I saw how much we were all struggling under the weight of working in healthcare during such an intense time. So I started to offer short yoga and mindfulness breaks during lunch or after work to my colleagues just in my immediate office. And they all shared how helpful it was. So that really began to spur my interest in employee health and well-being. And a short while later, I found my way here to Johns Hopkins, and the rest, they say, is history.
Well, we are profoundly grateful that you found your way to us at Johns Hopkins Medicine. Jen, there's such a lot out there right now about mindfulness. So perhaps before we go any further, could I ask you just to help us get on the same page about what you mean when you refer to mindfulness and how we live and work mindfully?
Sure. Very simply put, I think of mindfulness as bringing our attention or awareness to this present moment and not judging that. Another way to think about that is bringing attention or awareness to what is happening right now, not what has happened or not what might happen. And there are really two different buckets that I think of this in. There's bringing attention to what is happening in my internal experience in this moment. How's my body feeling? How's my mood today? What are my thoughts like? And for those of us that work in healthcare, that can be a little bit of a different practice because we are trained to attune to how everybody else is doing all day, how our patients are doing, how our clients are doing, how our family is doing. So really the practice of bringing attention and awareness to our experience can be profoundly impactful. And then, of course, there's bringing attention and awareness to what is happening around me right now with a true quality of presence. I'm sure that I'm not the only person that's had the experience that you're driving along in your car and you are so lost in thought that you drive right past the exit that you were supposed to get off at. So mindfulness really invites us to bring all of our attention and awareness to this moment.
And I love that you're describing it that way because I think in one of our earlier podcasts, we really have talked about the gift of presence. And in healthcare, we have to be so present with our patients, with the families, with each other. It's hard to do that when our brains are somewhere else.
Exactly. And there's also the invitation to notice how you are relating in the present moment, how you're relating to yourself. Is that from a place of kindness and care and compassion, or are you relating to yourself coming from a place of self judgment, criticism, pushing, and striving? And then how are you relating to the people around you? Are you truly present with your patients or your family members or your spouse or your neighbor? Really considering how you're showing up and noticing that in any moment. And again, not judging it, just being curious. What is the quality of my presence in this moment?
Also, maybe we could dig a little deeper into this because we have talked before, and I think we've also mentioned in this podcast that we really believe that healthcare is a deeply relational business and that everything that we achieve in healthcare depends on the quality of our relationships. So perhaps we could explore a little bit those different types of relationships we have at work and how mindfulness or being able to live and be fully present in those relationships supports both the relationships and then the work that we do together.
Sure. I think that's great because often, I think most often, we hear about the individual benefit of practicing mindfulness. Things like lowering stress levels, improving focus, improving performance, decreasing anxiety. I could go on. But it can also really profoundly impact our relationships when we are able to bring a mindful quality into all of our interactions. So, the first place that I think about this, perhaps obviously at work, is with our colleagues. And one of the things that we've worked really hard to do as we've been bringing mindfulness to the employees of Johns Hopkins is to teach teams to practice mindfulness together. Because while it's great to have individual people practicing, if a team is practicing as a whole, we are really creating and establishing a new norm for the team, for the department, and then that spills out into the larger organization. And there's a lot of research to show that when we practice mindfulness, we have increased capacity to regulate our emotions, our coping responses improve, and we have an enhanced sense of psychological safety, which on the team level is really important because then this contributes to things like an improved sense of trust, openness, and connection with our teammates. And when the quality of our relationships with our teammates improves, this also positively impacts the quality of care that we're able to provide for our patients and the quality of work that we're able to do because we feel this sense of safety, openness, and trust with the people that we spend our days with.
You know, I've heard so many people on the unit say to me, sometimes I'm so distracted that I'm having a hard time making decisions. And obviously, they're self aware, so they do something about it so that they're able to provide the kind of care that they need. But it's interesting, given how rapidly healthcare is changing right now, it feels that we're spinning sometimes. And I can imagine that teams that are able to recognize that perhaps they're spinning and able to bring themselves fully back into non judgmental presence are really supported.
They are. I get feedback often from employees about how these very seemingly small, simple practices have had profound impact, not only on the relationships that they're having with their colleagues, but on their ability to move through the day differently. When you are able to notice that you are in a place of frustration or a place of overwhelm, then you're able to take steps to manage that. But if you're completely unaware, it's hard to know then how to move forward.
Mm.
Now, the other place that practicing mindfulness can really, really have profound impact at work, especially in healthcare, is with the clients, the patients, and the families that we're serving. And when I think about this, I think the invitation here is to really consider, how do I bring my whole self to this interaction? Knowing that I have all of these notes to do, I have all of these other tasks, all of these other meetings. And right now, my role is to be here with this person. How am I showing up for them? Where is my attention? And so, a lot of the practices that I teach really train us to be present in this moment rather than lost in thought with all of the things that we know that we have to get done. But right now, my role is to be here with this person. And then notice not only how I am showing up, but how are they showing up so that I can relate to them the way that they need and are asking for in this moment. And then the last place that I think about how this spills over is with our families and our children and our partners and our friends that we then go home to after we leave work. And it's really the same thing there. The invitation is to notice the quality of presence. You've just left your work day and you're trying to have dinner with your family, but you're still lost in thought about the meeting that you had earlier or the interaction that you had with your patients. And of course, it's normal to be thinking about those things, but one of the things that we've been working really hard on here at Johns Hopkins Medicine is helping our employees create work-life balance. And so learning how to practice mindfulness can really teach you how to train your attention to be where you want it. So if you're having dinner with your family tonight, your presence is there. I'll share that I've had a few significant losses in my personal life over the last year and a half. And one thing that I'm keenly aware of is that this life is short and we don't want to miss it. And we're so distracted with our thoughts and our phones and our phones and our thoughts. I like to joke that those are the two things that are really taking us out of the everyday moments in our lives. So learning how to practice really being at dinner with your family, really being in the conversation with your patients, really being with yourself. It's hugely impactful.
This is just so kind. I have heard so many people either talking, to me, obviously, or in groups about how at the end of a shift, they find themselves going down the checklist of everything they didn't get done or everything they were not able to be for a patient or a colleague. And that's such a heavy judgmental load to carry after several hours of being fully present, to then feel that you're beating yourself up about the fact that you couldn't deliver 150% of effort. And so maybe I could ask you just to sort of reinforce a little bit the connection between these mindful practices and self-compassion.
Sure. I think that goes back to what we spoke about a few minutes ago in terms of being aware of how you are in this moment. And that may be how you are feeling physically, how you're feeling emotionally, mentally, and then noticing how you're relating to yourself. And, one of the things that I teach is that most of us that work here at Johns Hopkins Medicine, I'm going to say all of us that work here, got here by working really, really hard. And we have an amazing, amazing enterprise full of really committed employees. And there tends to be this striving, not just in our culture, but I think in the larger culture, where we feel like we always need to be doing more, pushing harder, going faster. And that is what we think leads us to where we're trying to go. But what often happens is that is also what's contributing to our feeling of burning out, of not being enough, our feeling of falling short. And so we almost end up like a dog chasing its tail because we feel like we need to be doing more all of the time. So the first step, though, is to really notice when you're in that space. And the way that I encourage people to practice this is to really turn to yourself, just like someone that you love or care about, who is working really, really hard and serving a lot of patients and also taking care of a family at home and all of the things that so many of us are juggling, and speak or relate to yourself like you would that person that you love or care about. Now, to be very honest, this is a challenge for most people. And I know that because when I teach it, I'm fortunate to have employees that will reach out to me and say, that workshop was really helpful and it was really, really hard. And this is why we call these things a practice, right? Because for most of us, we haven't been taught how to relate to ourselves coming from a place of kindness and compassion. We really have grown up in this culture of you need to push harder, go faster, and do more. So it can be a huge shift for a lot of us, and it does take practice over time. But the other piece of that is that it is totally possible. It's the analogy that I often use is, if you want to start lifting weights, you start with a small amount and build up over time. It's the same thing with learning how to practice compassion with yourself. You may not be able to do that all of the time every day at the outset, but you can begin to practice in small moments. Maybe noticing when you made a mistake, and instead of going back to the old pattern of beating yourself up, just coming with curiosity about any story you may be telling yourself in that moment, and then see if you can offer yourself even 2% more kindness than you would have before. And there are lots of different self-compassion practices that people can lean into. But the first piece is noticing how you're relating to yourself and then considering that there may be a different way.
Hmm. Lynn, could we perhaps transition now to talk a little bit about some of the programs that you offer? Because even though we're talking about things you offered at Johns Hopkins Medicine, I hope that listeners to the podcast will be able to imagine how these practices might be relevant to them wherever they are working.
Sure. So I'm happy to share that there are lots of opportunities to practice mindfulness here at Johns Hopkins Medicine. The flagship offering that I've created is a 4-week series called Live and Work Mindfully. And I mentioned earlier that we've really focused on teaching teams how to practice mindfulness together so that we are creating a norm within the organization. So the Live and Work Mindfully program is a 4-week series where teams learn the basic principles and practices of mindfulness. And then, of course, there's some opportunity to practice outside of those sessions so that they are learning how to apply the skills in real time. It's great to learn these things, but then we also need to take them outside of the sessions and bring them into our real lives, both at work and at home. So Live and Work Mindfully is our flagship offering, and it's been really, really well received. There are a couple of other options as well. So we have something here called our Worksite Wellness Menu, which is literally a menu of wellness offerings that employees and managers can go to request for their teams. And we have several mindfulness specific offerings there. Additionally, we have something called Mindful Monday. So every Monday from 12 to 12:15, I lead a mindfulness practice open to everyone in the enterprise. And truthfully, this is the highlight of my week because we have hundreds of employees who log on to that call from all across the organization. And there is such a sense of community, there is enthusiasm, and there is a lot of compassion there. So if you have not joined, the information for that can be found on the Healthy at Hopkins portal and the Office of Wellbeing website. Outside of that, we had a lot of employees request support for when they cannot attend live programming. And we've created something called the Stress Less video series. So this is a series of 5 videos that are 5 minutes or less with short mindfulness practices. And those can be found on the Office of Wellbeing website, the Office of Wellbeing YouTube channel, and the Healthy at Hopkins portal. Outside of all of those structured things, there is the opportunity to take advantage of the Calm app. So all Hopkins employees can access the premium version of the Calm app for free. It's a really great resource. The app that I use personally that I've used for years is called Insight Timer. I just never made the change when I came here to Hopkins, but I think encouraging people to lean into the resources that feel most resonant for them. The other piece of this is if you don't want to download another app or have to navigate another thing, there are lots of ways to practice mindfulness without any of that. I really try to teach our managers, our teams, and our employees that it can be as simple as taking 10 seconds to notice your breath between tasks, or starting every team meeting with a short breathing practice. Then there are also opportunities throughout our workday to bring little mindful moments in. In healthcare, we are constantly washing our hands. So as you're washing your hands, take that opportunity to make it a mindful practice. And if you have no idea what that means, it's really inviting yourself to bring again all of your presence to that moment, noticing what the water feels like on your skin, maybe noticing what the soap smells like, bringing awareness to the temperature that you're feeling, rather than, washing your hands, going through your to-do list with the 427 items in your head as you're trying to wash your hands. There's also mindful eating can be a really great practice. I get a lot of questions about this from employees, I think because in our larger culture, we are rushing all of the time. And certainly working in healthcare, we are short on time. So bringing mindfulness to our meals can be really, really helpful in slowing us down and really encouraging us to take the time to nourish ourselves. Now, one of my favorite mindfulness practices to incorporate into my workday is mindful walking. I find this helpful for a few different reasons. One, because I spend a lot of time, like most of us, looking at a screen. And so mindful walking invites me to take a break from that. And if I can, I like to go outside, even if it's for 5 minutes, just to give my brain an opportunity to have some different scenery. And I don't plug in my earbuds or look at my phone. I really use the opportunity to connect with the world around me. And again, give my brain a break from all of the stimulation that is a part of our work world. And a lot of our employees really enjoy doing this as well. Even if you feel like you're walking around all day, there's a different quality to mindful walking where you are very intentional about noticing, what does the earth feel like under my feet? What does the air feel like on my skin? What is the light in this place? And that in and of itself can really help shift our systems out of this, again, place of overstimulation and rushing into a place of true presence if we allow it to.
I love the way that you describe these mindful moments and these mindful practices. And I'm actually reminded of one of our colleagues here at Hopkins who talked once about mindful transitions. And when I asked her what she meant by that, she was like, well, when I'm walking between one patient's room and another patient's room, I have to become fully aware that I need to sort of leave that patient I've just seen behind. And as I'm walking to the next room, I'm actively transitioning to be fully present with my next patient. And she uses a combination of noticing the movement between the rooms. And then when she does her hand sanitizing, she uses that as a mindful practice to focus on her intention for her patient. And I hadn't really thought of it as being a combination of mindful practices, but that's exactly what it is, so that she's able to be fully present and intentional when she walks to that next patient's bedside.
I also really like that because she's bringing it into her everyday experience. One of the biggest things that I hear from people is that they don't have time to practice mindfulness. And I definitely appreciate that, right? We are all juggling a lot. But I know when I was still practicing as a clinician, I would do something similar to what you just described, whereas as I was walking to get my next patient, I would be doing a breathing practice and I would be checking in with how am I in this moment? And then how can I most fully show up for this next person that I'm about to see? But these are all things that we can make a part of our everyday experience. We don't necessarily have to set aside, 10 or 15 minutes to do a seated practice. It is great when we can, and I am fully encouraging all of us to do that when we can, but it doesn't need to be all or nothing. It can be both when we're able to.
Thanks, Jen. So just as we begin to wind up, we're obviously going to connect to the resources that you mentioned on the podcast page. But if our listeners are interested in practicing how to live and work mindfully, are there specific resources you'd encourage them to look at first?
I think that, again, it's important for people to start where they are and with what is most resonant with them. So, for our Hopkins employees, I would really encourage, and I am smiling as I say this, I hope that is coming through in this podcast, to join us on Mindful Monday because that is such a wonderful community of people who are really excited about practicing mindfulness together. And if that is not ever going to be possible for your schedule, that's okay. That's why we also have things like the Stress Less videos and the Calm app. Start with what feels most accessible to you. And again, if you don't want to do any of that, or you don't want to have an app, or the schedule feels overwhelming, maybe just invite yourself to start with some mindful walking, mindful hand washing, or mindful eating.
So this is the last thoughts question that I always ask our guests. Would you mind sort of sharing one of your real aha moments or one practice that you would consider to be an absolute cornerstone or anchor practice for mindful living and mindful working?
Yes, I would be happy to do that. So, the first practice that I teach when I work with groups over the 4 weeks is bringing your awareness to your experience. And this is something that I feel so passionately about for people that work in healthcare. Again, because we are trained and we spend our days attuning to how everybody else is, and then what happens is when we are not also attuning to how we are, we can become completely disconnected and burnt out. We also need to be taking care of our needs. So the first place that that begins is with noticing where we are and how we are. So the very simple practice of pausing and noticing, how is my body in this moment? What sensations am I noticing? Is there tightness? Is there tension? Am I cold? Am I hot? Am I hungry? Am I tired? Etc. And then also inviting yourself to notice how your emotional state is. What is your mood like right now? And again, there's no need to judge it or try to fix it or change it in that moment, but just noticing. And then lastly, inviting yourself to be curious about the quality of your thinking. And this can take as little as 30 seconds. You don't need to set aside a lot of time to do this. This can happen as you are waking up in the morning or as you are on your way to work in the car or on the train or the subway. But taking at least 30 seconds once in your day to bring your awareness to your experience, because then you can learn how to meet your needs so that you can be meeting the needs of your patients and your clients.
Thank you, Jen. It's been lovely to talk with you about this, and I hope to our listeners this has been valuable. And we invite your comments on our podcast page, and please let us know if you've tried some of these practices that Jen has offered today. Jen, thanks again.
Thank you for having me. It's been really nice to be here.
And thank you once again to our listeners for the gift of your time today.
So that's it for today. If you enjoyed what you heard, please share this podcast with a colleague. And as always, we welcome your feedback.
If there are any topics you'd like to hear about, please email us at owb@jhmi.edu.